society, we must act stringently and quickly so as to prevent any rebound. And we must fight this war against the pandemic strenuously and win this battle of eradicating all the infectious cases and to keep people safe and sound. To that end, we must coordinate the pandemic prevention and economic development. Sibozi Village, Lifangji Building in Haidian, Fengzhou Market in Fengtai, and the Oriental Plaza in Dongzhen districts must be checked and examined closely, and different districts must also execute the 8-hour emergency response mechanism and do a good job in tracing the cases. Considering the features of this virus and all the other risky pointers, we must considerably arrange the containment measures, and we need the close coordination from the neighborhood committee in order to have a quick screening of the risky places and population, and we must transfer and quarantine those risky population as many as possible. And we must also take a tough stance in the contained areas, the managed areas, and the prevention areas management. We must dynamically reallocate those 3 areas, and according to the needs, we must be able to dispatch those urgently needed materials and resources, and there must be 24/7 people on posts for those checkpoints. And for the civilians, they must keep to their stay-at-home policies. And for the pregnant women, elderly people, and the other patients suffering from special diseases, we must meet their needs immensely. And the different parties must hold themselves accountable so as to go to the grassroots level and respond to the masses' concerns. And they must also pay attention to the masses' mental health and offer some caring for them. And we also hope to work solidly in the neighborhood in order to build a firewall against the virus. And for the 4 parties, they must also hold themselves accountable, especially for those vulnerable sectors. Whoever is responsible must hold themselves accountable for the pandemic containment. For example, the public security, maintenance, operation personnel must hold themselves accountable in their daily work. And for the service people, their entities, their families must be the only places they frequent every day. For some prioritized entities, it must be kept in a closed-loop management. And we must also elaborate on the arrangement of the finals of the students. And on that basis, we arrange the students to go home in an orderly fashion. And those students must plan out their traveling to their hometown, and to our utmost capabilities, we must do a good job in the containment when they are traveling back home. In this presser, we have invited Wang Jianhui and the publicity head of Haidian District, Xiao Dan, from Fengtai District, Mayor Kong Gangcheng, from Shunyi District, the Executive Deputy Mayor of the district, Zhang Yanning, and from Beijing CDC Branch, Deputy Director Liu Xiaofeng. They will take the questions from our media friends. First of all, let's invite the Beijing CDC Deputy Director Liu Xiaofeng to brief us the newest information of Beijing pandemic and the readjustment of risk levels in Beijing. Dear media friends, good afternoon. On May the 27th, the newly added local confirmed cases amounted to 23, including 10 in Fengtai, 9 in Haidian. In Dongcheng, Chaoyang, Shijingshan, and Mentougou districts, there was 1 respectively, including 4 mild cases, 4 moderate cases, and there was 0 COVID found in this society. And those cases that used to be asymptomatic areas have been reported. Since the 18th, there was 12 newly added cases, including 8 in Haidian, 2 in Fengtai, in Xicheng and Chaoyang, there was 1 respectively, including 1 moderate case and 6 mild cases and 5 asymptomatic carriers. They were all the quarantined population, and there was 0 case found in the social sector. Those people have been transported to the designated hospitals for treatment. Since April the 22nd to the end of today, we have cumulative of 1,700 confirmed cases covering 15 districts, and in Chaoyang there was 423, in Fengtai district there was 370, in Haidian 245, in Tongzhou 79, and in Shunyi 44, in Xicheng 40, and in Dongcheng 30, in Shijingshan, Changping district 22 respectively. In Daxing district 16 cases, in Mentogo 6 cases, in Niyang, Yangqing 2 cases respectively, in Huairou and Yizhong district 2 cases respectively. Since April the 22nd until today, there was no case reported in Qinggu district. In Huairou, Yanqing, and Yizhong, there was no spring cases in the society. In Shunyi and Miyun districts, there was no case found in the society in the last 10 days. And in Fangshan, for 7 days in a row, there was 0 case in the society. In Chaoyang, Tongzhou, Daxing district, for 3 days in a row, there was 0 COVID found in the society. So in Beijing, this epidemic situation is picking up, and this achievement is hard won. So we must work hard on preventing the rebound. We must be committed to the zero COVID policy and act quickly and elaborately in our containment measures. And we must also hold the 4 parties accountable and intensify our supervision of the industries, especially in the catering business, maintenance, the public security, and the other special groups as to the villages, the entities, and public places, temperature check and nucleic acid test result in the last 48 hours must be maintained. In the contained areas and controlled areas, the service must be guaranteed. Before the containment was relieved in the neighborhoods, the people must take self-protective measures and take a healthy and scientific policy towards self-monitoring. The civilians must monitor their own health and do the nucleic acid tests regularly once they have symptoms like fatigue or the loss of their appetite or throat pain and muscle pain or diarrhea or the fever and other symptoms relevant to the COVID-19, they must report themselves immediately. And do not to go to the pharmacy or take medications on yourselves. And please have a scientific view towards this pandemic and wash your hands frequently, keep good ventilation, and keep social distance from others. If you go to a public place, please scan your health code and take some other regular containment measures. Now, I would love to report the readjustment of risk levels. By the end of May the 27th, 2022, according to the evaluation of the CDC branch in Beijing, and in line with the risk level standard, in Fengshan district, there will be the following change. In Douding Township, Douding Industrial Park, have witnessed 1 locally reported case in the past 14 days, so the risk level is low right now. And by now, there are 7 high-risk areas, 16 intermediate level risk places. That's the end of my report. Thank you, Mr. Liu, for this briefing. Now, on my part, I will publish the joint prevention and control mechanism in Beijing requirements considering the dynamic implementation of containment measures in the society-wide. Dear media friends, since April the 22nd, we saw a new round of the virus infection from Omicron. And we were confronted with the very severe situation, and we were committed to people-orientedness and put people's life and safety first. We remain true to the dynamic zero-COVID policy and acted timely and stringently by relying on the support of the public. We have taken a tough stance and make some determinations in handling this virus, and we readjusted our containment measures flexibly. For example, we have suspended the eating out policy, and the students were advised to go back home. And in prioritized places, we asked the employees to work by staying at home. And we also changed the operation hours in some public places. So we made our efforts to keep Beijing in operation as to the basic functionalities and strike a balance between the operation of the city and people's life and safety. In the city as a whole, people have been fighting against this virus with one mind. And in the past several days, we've seen a declining trend of the reported cases in Fangshan, Mentougou, Shunyi, Huairou, Pinggu, Miyun, Yanqing, and Yizhuang districts. For 7 days in a row, there was 0 case found in the society. In Xicheng, Chaoyang, Shijingshan, Tongzhou, and the Daxing districts, in the past 3 days, there was no newly added cases in this society. And for the screened out cases, the number is within our control, which testifies that this round of virus has been under control. And now, Beijing is going to turn to a regular containment policy instead of an emergency response policy. So we have to have stable implementation and never drop our vigilance. We must be clear-minded and do not turn a blind eye to the containment measures. We will also hold the four parties accountable and take stringent measures in this society. And we will try to avoid a rebound, and we will not overlook the containment measures in any sector. According to the experts, the Joint Prevention and Control Mechanism in Beijing Leadership Committee has decided that since May the 29th, we will have a dynamic implementation of the social level containment measures, including the following. For the contained areas and controlled areas, and the prioritized places, if evaluated, qualified, the containment will be released, except those people living in the contained and controlled areas. If in the past 7 days there was no case found, there will be normal life and production order. In Fangshan and Shunyi district, the stay-at-home policy will be changed to going to work normally. As to Chaoyang district, Tongzhou district, there will be a policy to relatively increase the ratio of people on post. In Chaoyang, Shunyi, Fangshan districts, all the other places other than the contained and controlled areas, the public transportation will resume their operation, except the shopping malls within the controlled and contained areas, and the shopping malls that have suspended operation because of the pandemic will resume the operation. But the promotion activities and other activities that may lead to a gathering of population are still not allowed. For the districts that have seen no case in the past 7 days, the delivery man can enter into your neighborhood, and they can put aside those packages on the shelves or the other places to have contactless delivery. In Pinggu, Huairou, Miyun, Yanqing districts, the different sorts of hotels and the other catering businesses will resume their operation. As to the scenic spots, parks, there must be a limitation of the visitors at a certain hour, and they will try to keep a 50% of an open ratio for the library, museums, theaters, galleries, and cultural museums and fitness clubs that have seen no case in the past 7 days, except the underground places, will also open themselves according to the ratio of 50%. And under the precondition of stringent implementation of the containment measures, the normal operation and production of enterprises must be guaranteed in order to ensure a stability in the production line and the supply chain. To cement the good momentum, we will also be committed to the stringent measures. For example, eating out is still not allowed. It will be postponed, and the students in middle school and primary school cannot make back to their campus yet. And we will try to offer sufficient services on the campuses. By arranging the final examinations for the students, we will gradually take steps to organize the students to come back to Beijing. And as to the KTV and the other underground places, their operation is still postponed. And for the sporadic home projects in the neighborhoods, they are postponed. And there must be 24/7 checkpoints for the people going into the public buildings, the villages and communities and entities. There must be some temperature check and the nucleic test results in the past 48 hours. For the entry and exit of Beijing, there must be a check of the nucleic acid test result in the past 48 hours and the health code. Upon arrival in Beijing, in 24 hours' time, there must be another round of nucleic acid test. Considering the faster transmission of Omicron and the insidious character of it, for the prioritized affected places and the industries, for example, the cold chain business, the supermarket, transportation channels, and home furnishment, and the villages in the downtown area, and the risky population in the public places, there must also be the nucleic acid test on a regular basis. And we will continue to improve the disposition of those sample-taking stations so that people will find it convenient to take the samples. And for the above-mentioned readjustment policies, we may dynamically make a new assessment based on the situation of this epidemic. The achievements we made in the containment is hard one. So we would love to thank all the civilians for your dedication and your contribution. Right now, we are still at a critical moment. Such relief measures doesn't mean that we will drop all of those policies. We must still be committed to the containment measures and be able to reactivate those stringent measures anytime once needed, and we must work together to safeguard our homeland. That's all I would love to say. Now let's give the floor to the member of the Standing Committee of Haidian District, Madam Xiao Dan, to brief us about the situation in Haidian. Dear media friends, as to the situation in Haidian, first of all, about the cases. On the 27th of May, the newly added local cases in Haidian district amounted to 9. All are the quarantined population. Their information has been reported yesterday. And on the 28th of May, the newly added local cases in Haidian district stood at 8. All are the quarantine population, and they were all transported to the designated hospitals. For case number 1, resides in Youyi neighborhood of Haidian Street. And from the 21st to 26th, the test result was negative, and on 28th, the test result was positive. Case number 2 resides in Haidian Street, Youyi neighborhood. On the 22nd till 27th, the test results were negative. And on the 22nd he was kept in collective quarantine, and on the 28th, the test result was positive. Case number 3 lives in Sibozi village of Qinghe Street. From 20th to 25th of May, test results were negative, and on 26th, he was collectively quarantined, and on 28th, the test result came out positive. Case number 4 lives in Haidian Street, Lifangting building. From 21st of May to 26th of May, the test results were negative, and on 28th, the nucleic acid test result proved to be positive. Case number 5 resides in Qinghe Street, Sibozi village. Since May the 20th till the 25th, the nucleic acid test results were all negative, and on 26th, he was kept in collective isolation, and on 28th, the test result was positive. As to case number 6 and number 7, they both reside in CGTN Township, Tongjiafen village, and on 23rd, they were isolated collectively, and on 28th, the test result was positive. Case number 8 lives in Sibozi village of Qinghe Street, and on 25th, the case was collectively isolated, and the test result was positive on the 28th. And as to the new risky places, on the 24th at 10:30 to 1 p.m., 2 p.m. to 5 p.m., 6 p.m. to 9:30 p.m., Wumei Supermarket C3 store. On May the 25th, from 6:40 to 10:47 a.m., from 1 p.m. to 3 p.m., Wumei Supermarket C3 store. From the noontime to 1 o'clock, Maofang Street and Binghe South Road intersection, Yehuaqi Station. And from 6 p.m. to 6:46 p.m., Yonghe. And if you have paid visits to the above-mentioned places, or if you have any abnormal situation in your household, please report yourself to your entity, your neighborhood committee, and your hotels. And secondly, as to the containment measures in Haidian District, according to the arrangement in Beijing, in Haidian District, we strictly execute the district-level dynamic containment measures in a dynamic way, and we have taken the following measures. First of all, the containment time started from May the 28th. Since we have seen no case in the society for 7 days, we have readjusted the policy. But still in the district, there will be work by staying at home. If you have an emergency to pay visit to your entity, you must show your negative results of the nucleic acid test in the past 48 hours. As to the neighborhood committee and the villages, there must be closed-loop management, and there must be 24/7 checkpoints on posts, and there must be temperature check, the certificate check, and the nucleic acid test result check in the past 48 hours if you want to exit or enter. For the delivery men or the other service people, they were forbidden to enter. Except the supermarkets, the catering businesses, the eating out policy is still maintained in the whole district. All the indoor entertainment places like the fitness clubs and the plastic surgery hospitals and the others are forbidden to operate. As to the theaters, the art galleries, the museums, they are not open to the public yet. Fifth, except the shopping malls within the controlled and contained areas, the shopping malls that have been suspended operation because of the pandemic can resume their operation, but there will be no promotion activities in order to control the population flow. As to the indoor fitness clubs and the training institutions, indoors, their operation cannot be resumed, and the higher learning institutions will continue to adhere to the previous policies. For the high-risky populations and high-risky places the containment measures remain the same. In 马莲洼、优胜 Plaza and 中关村西区、普惠南里 neighborhood and 5 prioritized areas in the south of 普惠里. According to our reassessment, we can manage them by elevating the risk level. As for 清河 neighborhood, the previous risk level policy will be remained. In the next step, we will continue to work stringently on the different containment measures in order to have dynamic zero COVID achievement. I would love to thank all of you for your support and understanding of those containment measures. Thank you, Madam Xiaodan. Now, let's give the floor to Mr. Kong Gangcheng to brief us about Haidian District. Dear media friends, good afternoon. On May the 27th, there were 10 newly added local cases in Haidian, and on the 28th, the newly added infected people were 2 cases. They were all the isolated population, and there was no new risky place, and those cases have been transported to the designated hospitals. And I would love to share with you the following information. First of all, we will take collective efforts to manage the risky population and the risky places. In the eastern part of Haidian district, there were some new positive cases. So we are now carrying out the tracing activity in order to find out all those close contacts quickly. In Fangzhuang Market, all the personnel standing at 195 people have been checked, and 18,000 people have paid visits, and 17,000 of them have been within our control. In Fangzhuang, Dongtie Jiangying, Shiliuzhuang, and Chengshou neighborhoods, we have set up some contained and controlled areas with a dedicated panel to manage them, and we have a grid-based management stringently for the 21 districts and 55 grids. We have set up a special head to manage them, and they will hold themselves accountable for the special grid under their control. And we will coordinate the nucleic acid test, the risky population management, and the service supply. And the different entities have enhanced their law enforcement by closing 891 different entities. As to the pharmacies and supermarkets, 127 were kept in operation. And together with the e-commerce platforms, we have done a good job in guaranteeing the life necessities on the shelves and instant delivery to the doorsteps. And as to Yuegezhuang Market, we will coordinate with the different players to cut off the transmission of the virus. Since May the 17th, as to the surroundings of Yuegezhuang Market, we had taken the temporary containment measures. During the containment period, we will work on 2 fronts to guarantee the normal order within these surroundings. And since today, for the containment time period and scope, there will be a dynamic readjustment. For example, for Jinggang Highway, especially the north of it, we will have containment. And there are 3 places to the south of the Jinggang Highway, except Wulidian Pingfang district. The others will be relieved the containment measures, covering 20,000 population. So we hope to cement the achievements of the containment measures. And for the civilians living in the contained and controlled areas, please keep committed to the containment measures and have a self-monitoring of your health status, and do not go out of your community. For the villages and the neighborhood committees, please have 24/7 checkpoints at the entrance and have certain measures taken, such as test, result check, and the disinfection of the environment. And in Fengtai district, we will act quickly and carefully to win this battle against the Omicron virus. That's all I can share. Thank you, Deputy District Mayor of Fengtai, Kong Gangcheng. Now let's turn to Shunyi District. The spokesperson of the Shunyi District Office, Zhang Yanling. Good afternoon, dear media friends. Since May the 22nd, we have witnessed 44 positive cases, all infected by Omicron virus. Under the leadership of the Municipal Joint Prevention and Control Mechanism, we are committed to the dynamic COVID policy, and we acted quickly and effectively in tracing, containment, lockdown management, nucleic acid test examination in order to win the time against the virus and have win this battle for now. And for 21 days in a row, there was no positive case found in the society, and we have a stable achievement in eradicating the infection cases in the society. And according to the municipal level containment measures, we have taken certain policies. For example, temporarily suspend the bus, the hailed cars, taxis, and other public transportations, and reduce the ratio of staff on post, and suspend the operation of public places. Within a short time, we have effectively cut off the transmission chain and ensured people's safety. We deeply feel that the achievements of the fight against the pandemic are indispensable from the coordination from the civilians and the enterprises. They have conquered the different difficulties and inconveniences brought by the containment measures and participated in the test voluntarily. They even turned to volunteers in the stations, reflecting their big picture view. And to that, I would love to thank our civilians. For the residents to resume their normal life and for the enterprises to resume their production, we are now responding to your concerns. According to the city-level arrangement, we will gradually take steps to readjust our containment measures in the district. For example, they can go to their workplace as normal, and as to the public transportation, there will be a resumption of the operation. And under the precondition of temperature check and controlling the people flow, some shopping malls and can resume the operation, but promotion activities are not allowed. And the delivery man can enter into the villages and the neighborhoods by putting them on the shelves with contactless delivery. For the parks and scenic spots, there must be an appointment made, and there must be a ratio of visitors allowed to enter. As to the indoor places like the fitness clubs and the galleries and the museums, there must be a 50% of visitors. And also our district will continue to step up the resumption of production in the enterprises in order to maintain their usual production and operation. And we will continue to be able to reactivate our emergency containment measures. And we would love to remind our civilians, please continue to coordinate with us with all of those containment measures. For example, keep a social difference, no gathering, good ventilation, wash your hands frequently, wear facial masks in order to protect the hard-won results. And please get vaccinated in order to build such a firewall against the virus. Thank you. Thank you, Mr. Zhang Yanling, the Executive Deputy District Mayor of Shunyi District. Next, let's give the floor to Mr. Wang Qianhui to brief us about the establishment of the Zero COVID neighborhood and the pointers for the staff in the communities. Dear media friends, good afternoon. Now, I would love to brief you about the situation of those communities with Zero COVID. To implement the general principles of the dynamic Zero COVID policy and to keep zero case in the society and to cement the hard-won achievements of the containment measures and to protect people's safety and the usual production of the enterprises. In the city, we will take profound measures to establish those communities with zero case. As to the details, they are as follows. First of all, the objective. To establish those zero-COVID communities, we must hold those communities accountable for themselves and have the grid-based management. We will stringently execute those containment measures in the community level, and the villages and communities will take the brunt of the virus management. And there must be close management and precise policies. We must mobilize the party members, volunteers, civilians in the community level to participate actively and give full play to the party organization at the grassroots level and the self-governance of those residents in the communities. All of those communities and villages must be enabled to be the basis of our fight against the virus in order to protect people's life and safety. Second, criteria. It doesn't mean that in those villages and communities there will be zero case forever. Instead, there must be regular containment measures in those communities, and they must have high capability of mobilizing the society by publicizing those policies and educating the population and ensuring sufficient supplies and stringent execution of the containment measures, so that once a case is found, there must be scientific control and settlement, so that in the non-controlled areas there will be no case found. And to that end, our experts have offered their ideas about the criteria. For example, a framework and a sustainable zero-case situation and sufficient containment measures, good disinfection in the environment, and individual responsibility for the containment, and so on. There are 20 indicators in total. 3. The procedure of establishing such villages. The villages must voluntarily apply, and then they will be filed in the city level, and there will be dynamic management of the villages. Once approved through the media friends, the list of those villages and communities will be published to the public. And if they violate against our criteria, their title will be cancelled. Fourth, the individual responsibilities. The communities are the home for every resident. So in face of the severe situation of the pandemic, this policy will mobilize the initiative of the masses. They must work by riding on the same boat, and they must build such a firewall by mobilizing all people, so that the village and the community level will be the bottom line. We urge our masses to hold themselves accountable as the master of the fight, and they must be vaccinated by and also stay at home, wear facial masks, take a social distance, go to no parties, and with those deeds, they are contributing to building the firewall at the community level and build a beautiful homeland for all. Here, I would love to thank all the civilians for your support and your coordination. The community and villages are the basic unit, and they are also the main battlefield for the joint prevention and control of the virus. High-quality community-level prevention and control will be helpful of controlling the transmission of the virus. No infection in the community will help us to deprive the worries in the whole city. Now, I would love to introduce the guidelines for the staff members in the community levels to prevent against the virus. The staff members at the community level are confronted with different levels of risks of infection. So, for their own safety, recently, the community level prevention and control group has compiled a guideline for their prevention and control. And as to the details, they are as follows. First, why? Right now, the prevalent Omicron virus is highly transmittive very quickly. And once a case is infected, in a short time being, the number of infected population will rise up very quickly. So that's a huge burden on the community level. But luckily, we have a large number of first-line workers in the community level. And right now, the different communities have called upon the party members, the residents, and the other social forces to participate in the prevention and control efforts. Those people are very supportive of our efforts, but they have limited skills. If they overlook their own safety, they might be infected. We have seen such cross-infection before. Besides, we found that right now the prevention and control on the shoulders of those community workers are still not enough. So we must detailize the standards of such prevention and control efforts for the staff members so that they will have some reference to refer to, and then they can execute the containment measures more effectively and better serve the residents. Second, the basic requirements. To minimize the cross-infection possibilities for the staff members at the community level in different places of resting or eating, there must be some basic requirements of their protection. As to the contents, they include the following 9 points. First of all, wear and take off their protective clothes according to the strict requirements. Second, staff in the contained and controlled areas, they must be managed in a closed loop and they must reside in one single room alone and take the temperature check regularly. 3, during their work time, no gathering between the staff members, and when they are having meals, they must take the takeaway food and do not gather with the others. 4, keep good hand sanitation. They must wash their hands once they take a sample from the residents. 5th, a scientific arrangement of their residents. And 6, there must be scientific disposal of the medical wastes. 7, in the non-resting places, no smoking or drinking are allowed. 8th, no conference taken in the closed-loop management. And as to the delivery men, the volunteers, they are not allowed to have direct contact with the risky population. 3, for the different types of staff members, there must be differentiated protection rules to guide the personnel to do a better protection of themselves and to avoid overprotection. According to different risk levels and different requirements of different posts, for different sorts of personnel, there must be detailed and differentiated protective measures. First of all, according to the different risk levels and containment levels for the contained and controlled areas, there must be different levels of protection for their working staff. Second, as to the people standing on the post at the entrance and the delivery men, the cleaning ladies, the disinfection staff, the medics, and the supplementary staff of the sample takers, there must be differentiated protection measures. 3, detailize the rules of wearing and taking off the protective clothes and facial masks, the gloves, and the goggles, and 8 other items and articles. There must be standardized guidelines. And here, I would love to thank all the community workers for your contribution. Thank you, Mr. Wang, for your briefing. Now, we would love to open the floor to the media friends, and please identify yourself before raising the questions. No question. Okay, thank you all, and thank you, media friends and all the staff members. This is the end of today's presser.